Welcome to Functional Pain Management Society's educational material. Over time, we will grow the educational material here on the site. The base of everything we do, though, is the evaluation. This is the first of a three-part series describing the functional pain management intake form and psychosocial exam components cheat sheet. I'll give an overview here so it will make the other videos easier to understand and more efficient. As physical therapists, we all know the importance of evaluating people with a biopsychosocial approach. However, most, if not all, of our training has been in the bio part. This is partly because red flags deal with the bio part. But how do you evaluate the psychosocial part? The clinicians that are best at this have a ton of experience. Patients in pain can't wait for functional pain managers to develop enough experience to really know how to evaluate them. There's a lot of excellent training in live and online courses and textbooks and conference presentations. However, it can be quite difficult to put into practice. We need to simplify this process. We hope to simplify this process. We must simplify this process. If we can simplify this process, we will feel very successful. The magic is in identifying which of a multitude of questionnaires to use at the right time and what information do we need to ask in the subjective exam. We have to move away from classifying somebody as having psychosocial factors. What specifically does that mean? That's at least as broad as saying someone has a biological factor. Is it strength, range of motion, endurance, torn, fractured? We need to know which psychological or social factors the patient's problem is. We need specifics. The first key is to use the Functional Pain Management Intake Form, FPM Intake for short. This does not replace any other intake forms you're already using. It is specific to identifying psychological and social factors. The FPM Intake Form has three purposes. First, systematically identify if the patient needs a specific questionnaire. Second, obtain standardized information related to pain that may be relevant. Third, identify other specific questions or tests that need to be asked, performed in the exam. Now, this doesn't mean that this will dictate all of your questions and tests. We can't make it that easy. But these are the items that often need to be addressed, and it can be helpful to have a closed-ended question on the intake form to know whether we need to address it in the exam. For example, one of the questions is, have you experienced any traumas that you re-experience, nightmares, flashbacks, etc.? This could be asked in the subjective exam, but you could also easily forget it, especially when crunched for time. I know, that never happens to you. If they mark yes, then you aren't going to forget to bring it up in the exam. You could argue that they may not answer it honestly on the form. However, they may not answer it honestly verbally either. The basic tenet is to remember is that the FPM intake form isn't 100% sensitive and specific. It does not take away the need to be a careful, thorough clinician. It does help us to be more efficient and more often identify factors we need to be aware of. The details of this will be in the second video of the three-part series. The third video in this three-part series describes the psychosocial exam components cheat sheet. This cheat sheet is meant as a cheat sheet for psychosocial factors that should be evaluated. This is not given to the patient, but kept on your desk or saved on your computer. This is used in conjunction with the FPM intake form. For instance, if the FPM intake form says to use the Injustice Experience Questionnaire, do you know what score is recommended to be referred to a psychologist? That's what the psychosocial exam components cheat sheet is for. It also is to look at when evaluating progress with the patient. If they haven't made the progress you hope for, then this form needs to be looked at. Maybe you haven't addressed something on it that is a significant factor for them. Without this, you're just trying to keep a mental checklist for each person on what's important. This form keeps you from having to keep in your head all the things that you should look at and trying to mentally check off if you've addressed that with each patient. Very experienced clinicians with treating pain do a decent job of this. Again, our goal is to simplify this process so patients can get a more complete care without waiting for every clinician to be an experienced, thoughtful, pain-treating clinician. Again, our goal is to simplify this process so patients can get more complete care without waiting for every clinician to be an experienced, thoughtful, pain-treating clinician. The FPM intake form and psychosocial exam components cheat sheet is free on the Functional Pain Management Society's website. The FPM intake form can be co-branded for all FPM Society members. I hope this process is transformative for your care in treating people in pain and help make you an excellent functional pain manager.